I was co-author of a paper in 1975 that proved that this chemical imbalance theory could not be true. It wasn't true that depression was caused by a serotonin deficiency in the brain. And the pills weren't doing what the drug companies claimed they would do. And then I heard about cognitive therapy, this drug-free treatment. And at first I thought it was ridiculous. Beck said that depressed thoughts cause depression and that those thoughts are distorted. Depression and anxiety are the world's oldest cons. And when you change the way you think, you can change the way you feel. That's cognitive therapy in a nutshell. It actually goes back all the way to Epictetus, 2,000 years ago, was the first to teach that we're disturbed not by things, not by events, but by our thoughts about them. These events, and you saw that crystal clear with Karen, what she was telling herself about her daughter's horrible trauma. But I didn't believe it. I thought it was a silly form of therapy. I didn't think you could train people to think differently and eliminate their depression. And so I decided to go to Beck's weekly seminar just to prove to myself that it wouldn't work, that I would try it with some of my patients. And one of the first patients I tried it with was a Latvian immigrant. And she was referred to me from the intensive care unit at the hospital of the University of Pennsylvania. She had made she had attempted suicide and had just barely survived. And then they sent her to me for treatment, for follow-up care. And I did my usual thing, handing out prescriptions for antidepressants and asking her to express her feelings. That's how I was trained to treat people. And it rarely ever worked, to be honest. And so I said, could I present your case at this weekly seminar? There's this new thing called cognitive therapy, and maybe we could try it out. And she was fine with that. And so I presented her case the next week to Dr. Beck. And I said, what should I do? And he says, well, all emotions result from thoughts. And so what you can do is ask her, what were you telling yourself at the moment you tried to commit suicide? I said, oh, that makes good sense. So the next session I said to her, what were you telling yourself? Dr. Beck said to ask you. And she said, oh, I was telling myself I'm a worthless human being because I've never accomplished anything meaningful. And she said, so what should I do about that? And I says, I really don't know. If you would wait another week, I could go to the seminar again and ask him. So she was fine with that. So I presented the case, and Dr. Beck says, well, just examine the evidence. Ask her to make a list of things she has accomplished in her life. I thought, oh, that makes logical sense. That seems pretty easy. So in the next session, she said, what did Dr. Beck say? And Dr. Beck say, and I said, he said to make a list of some things you have accomplished in your life. And she said, well, see, that's the problem. I've never accomplished anything worthwhile, and that's why I'm a worthless human being. And so she said, so what am I supposed to do? And I said, well, I was stumped. I said, well, maybe you could take it as a homework assignment and see if you could come up with something during the week. And then she came back the next week, and I gave her antidepressant, and I forgot about the assignment and asked her to express her feelings. And halfway through the session, she said, didn't you want to see my homework assignment? And I said, oh, I forgot. Yes, were you able to come up with anything? And she handed me a piece of paper with 10 things listed. And the first one, she said that one thing that I might have overlooked was that I smuggled my children out of Nazi Germany and got them to the United States. My husband died in the concentration camps, and all of my family died in the concentration camps. But I managed to escape and save my children's lives. So I thought maybe that was an accomplishment I could list. And then number 2 on her list, and she says, when we got to the United States, I scrubbed people's floors and clean their houses. So we'd have a bed to sleep on, a roof over our heads, and food to eat. And she said that. I thought, well, maybe that was an accomplishment of sorts. And then she said, and my oldest son just graduated #1 in his class from the Harvard Business School. And I thought, well, maybe that was an accomplishment I could take some credit, partial credit for. And then I forgot that I speak 5 languages fluently. And in addition, I'm a gourmet chef. And as I was looking at this list, tears started going down my cheeks, and it was just stunning. And I said, well, how do you reconcile that with your belief that you're a worthless human being who's never accomplished anything? And she said, well, Dr. Burns, it doesn't compute. It doesn't make sense. And I said, well, how much do you now believe the thought I'm a worthless human being because I've never accomplished anything? And she says, I don't believe it. It makes no sense. And I don't even know how I could have thought that. And then I said, well, how are you feeling now? And she says, I'm suddenly feeling a lot better, Dr. Burns. And then she said, do you have some more of these techniques? And I said, no, that's the only one I know, but if you'll wait another week, I'll go back to the seminar and learn another technique, and we can try that one as well. And that's how I got drawn into cognitive therapy. And in 2 or 3 weeks, she was completely symptom-free and was ready to terminate her therapy. And I was just shocked. And I started using cognitive techniques with more and more patients and presenting them at the seminars and trying these new techniques and seeing remarkably rapid recovery from depression and anxiety disorders as well. And that's why I wrote Feeling Good, to share all these ideas with the general public and with therapists as well, so people would become aware of it. And when I published Feeling Good in 1980, it's when that was first published by William Morrow and Company in New York, there were only about 10 or 15 cognitive therapists in the world. And most people thought we were quacks. But in the years following the publication of Feeling Good, the cognitive therapy began to spread all over the world. The book began selling more and more copies, and research showed that just reading the book reduced depression, and cognitive therapy became the most popular form of therapy in the world and has become the most researched form of treatment in the world. But at any rate, that was just one of the early techniques. Examine the evidence, and again, it can be life-changing for some people, and for others it won't be effective, and then you'd use another technique.